video demonstration on the abdominal examination in children. The common scenarios that you encounter in abdominal examination can include children with hemolytic diseases like thalassemia or hereditary spherocytosis, or the child may have isolated splenomegaly in a background of prehepatic portal hypertension, or child may have chronic liver disease. Sometimes it can be an occasional child who is having a metabolic disease, or sometimes you might encounter a child with a palatable kidney. Whatever the cause is, it's important to practice correct techniques and then follow the basic approach and a structured approach so that you can work out a reasonable differential diagnosis based on your physical findings. And in this demonstration, we are going to focus on the short case approach. And for a short case examination, typically you are given approximately 10 minutes. And within that 10 minutes, you are expected to perform a relevant general system examination and an abdominal system proper examination, and followed by presentation of your findings, and to have a brief discussion about the differential diagnosis and some steps in management. Let's watch the demonstration. In any short case approach, it is very important that you have adequate exposure as well as adequate lighting so that you can easily pick up physical signs. And also, it's important that you obtain consent both from the child as well as from the parent. And this is especially important when the child is old enough. And it's important to clean your hands as well before any examination procedure. තාත්තා මම ඩොක්ටර් කෙනෙක් මම පොඩ්ඩක් ඔයාගේ බබාගේ බඩ පරීක්ෂා කරලා බැලුවට කමක් නැද්ද? Thank you. පුතා මම ඩොක්ටර් කෙනෙක් මම ඔයාගේ බඩ චුට්ටක් බලන්න යන්නේ කමක් නැද්ද? හා රිදෙන්නේ නැහැ. පොඩ්ඩක් හරි රිදුනොත් පොඩ්ඩක් මට කියන්න. එතකොට මම ඒක නවත්තනවා. හරිද? The first step in doing the abdominal examination is to have a proper look at the child as well as the surrounding. And it's important to look at the surrounding in some situations. For example, in a child with a biliary atresia, a very young child, there may be a nappy stained with acolic or pale stools. And there may be a urine pot which shows a tea-colored urine. And sometimes the child may be connected to a dialyzer machine or any other equipment or a cardiac monitor or an instrument equipment which give you some important clue about the likely condition the child is having. Therefore, observation of the surrounding is very important. After you observe the surrounding, it's good to start with the general system examination. I will start with examining the hands. Note for any evidence of wasting. Look at the subcutaneous tissues and the muscle mass. Look for any evidence of nutritional deficiencies like koilonychia. And look for any evidence of chronic liver disease like presence of leukonychia, palmaerythema, and diffutrine contractures and presence of flapping tremor. පුතා අත් දෙක මෙන්න මෙහෙම කරන්න උස්සලා. Thank you. පුතා ඇඟිලි දෙක අරගෙන මෙහෙම කරන්න. කළා දැන් මෙහෙම කරන්න. කළා ඇඟිලි දෙක එකට ගාවන්න. Right, good. Look for obliteration of the space between the two nail folds that might indicate evidence of early clubbing. Next step is to examine the face. And you might note any evidence of medullary hypertrophy, indicating maxillary prominence in a child with thalassemia major. And in a child with chronic liver disease, you might note evidence of icterus. පුතා උඩ බලන්න. පල්ලෙහා බලන්න. So icterus and pallu need to be noted. පුතා ඔයාගේ කටාර ඉන්න පුළුවන්ද මම ටෝච් එක ගහලා බලන්න හදන්නේ. හොඳද? So look inside the oral cavity for dental hygiene and any evidence of pallu or cyanosis. Right, thank you. It is also important to look at the eyes for any evidence of Glaser feature rings that are indicative of an underlying Wilson's disease. However, cave rings are best examined using slit lamp examination. The next step is examination of the lymph nodes. පුතා අපි වාඩිමු බලන්න. It's best to feel the cervical group of lymph nodes from behind, and you can use both hands to feel the cervical groups of lymph nodes. And you can feel the epitrochlear lymph nodes behind the olecranon processes. පුතා අපි නිදාගමු. පුතා මම පොඩ්ඩක් මෙතන බලන්න පොඩ්ඩක් කලිසම චුට්ටක් පාත් කරලා. So feel along the inguinal group of lymph nodes for any evidence of lymph node enlargement. To complete your general system examination, it's important to look for evidence of ankle edema in an older child or presence of sacral edema in a non-mobile child. And it's important to go to the foot end of the bed and then kneel down and then to have a proper look at the abdomen. Look for any obvious distension from either right or left side. And note down the pattern of breathing. Note down any evidence of umbilical hernia, divarication of the recti, or any evidence of surgical scars. Presence of a previous Kasai scar can indicate the child probably underwent the Kasai procedure for previous biliary atresia. Further in inspection, it is important to note down presence of any desferoxamine injection scars in the periumbilical region, which are suggestive of an underlying thalassemia major, or presence of caput medusae that are indicative of portal hypertension. Note any evidence of spider nevi or gynecomastia that are again suggestive of an underlying chronic liver disease. It's also important to note the skin color and the texture, as the skin may look hyperpigmented, especially in children with thalassemia receiving iron chelators or when you are having chronic kidney disease. It's also important to note down any evidence of scratch marks that are indicative of an underlying direct hyperbilirubinemia. In inspection of the abdomen, it is also important to look for scars that are sometimes may be hidden on the posterior aspect. For example, an underlying nephrectomy scar or presence of a renal biopsy scar. Right, thank you. The next step in examination is the superficial palpation. It is important to ask from the child whether any area of the abdomen is hurting, and so that you can avoid that particular area and then come as the last step in your superficial palpation. පුතා ඔයාගේ බඩ බලන්න කියලා හදන්නේ පොඩ්ඩක් මම අල්ලනවා කොහේරි බඩේ රිදෙනවද කොහේරි නෑ නේද? If the child doesn't have any tender areas or painful areas, then you can start your superficial palpation from the left iliac fossa. And while doing the superficial palpation, it's important to look at the child's face so that you can pick up if it's causing any discomfort to the child, so that that area can be tender. Let's now move to palpation of specific intra-abdominal organs. And you have to palpate the liver and the spleen and ballot the kidneys. Let's see how we can palpate the liver. Usually, the liver lies in the right hypochondriac region. So you can start palpating from the right iliac fossa and then gently go upwards asking the child to take deep breaths in and out so that you can feel the liver coming and touching your fingertips. පුතා හොඳට කටඇල්ල හුස්ම ගන්න බලන්න. හොඳට කටඇල්ල හුස්ම ගන්න. So once you've got the lower edge of the liver, it's important to size it. And to note down the liver span, it's important that you percuss the upper border of the liver. And always you percuss from an area of resonance to dullness. So you will need to start percussing from the upper rib spaces. පුතා මම ඔයාගේ මේ පපුවට පොඩ්ඩක් තට්ටු දානවා නේද? And then with the lower border and the upper border, you can estimate the liver span. It's also important to palpate the left lobe of liver, which may especially enlarge in a child with chronic liver disease. So you can start your palpation from the right iliac fossa and then gradually move your hand towards the epigastric region while the child is taking some deep breaths. පුතා හොඳට කටඇල්ල හුස්ම ගන්න. You will need to understand whether the liver has got a regular edge and the type of consistency, whether it is soft or firm, and the surface, whether it's regular or irregular. A presence of a nodular liver may indicate an underlying chronic liver disease. You can reconfirm the liver edge by percussion starting from the right iliac fossa. පුතා මම බරට තට්ටු ටිකක් දානවා. හරිද රිදෙන්නේ? And it's also important to auscultate of the liver to assess for presence or absence of any hepatic bruise. Let's now palpate the spleen. Spleen usually lies in the left hypochondrium, and when it enlarges towards the right iliac fossa. So in order to pick up an enlarged spleen, you have to start palpating from the right iliac fossa. And in the same way that you felt for the liver, you will have to ask the child to take some deep breaths and then use your hand to see whether you can feel the moving spleen coming and touching on your fingertips. පුතා ආය අපි කටඇල්ල හුස්ම ගන්න. හොඳද? And you can percuss to see whether you can feel the splenic dullness. And if you still can't feel the spleen, you will need to keep the child in the right lateral position and then try to palpate the spleen again. පුතා අපි පොඩ්ඩක් මේ පැත්තට හැරෙමු. සයිඩ් එකට ඉන්නකෝ. right? ඔන්න ඔහම ඉන්න. If you note the spleen, it's important to note for presence of any splenic notch and the surface, whether it is regular or irregular, and to look for the consistency, whether it's firm or hard, and to presence of any splenic bruit. To confirm that it is spleen, you will have to ensure that you can't get above that mass, and also it needs to move with respiration. The next step in abdominal examination is palpating for kidneys and balloting the kidneys. The kidneys can become palatable when they are enlarged. For example, when a child is having an hydronephrotic kidney or a polycystic kidney, your kidneys can become easily palatable. And let's see how we can ballot the kidneys. So you have to keep your dominant hand from behind and then the other hand over so that the kidney is sandwiched between your two hands. And then gently apply forward pressure from your dominant hand so that you can feel whether the kidney is coming and touching on your hand lying over the anterior abdomen. You will have to repeat the same sequence to ballot the right kidney as well. The next step is percussion for presence or absence of any free fluids. A child can accumulate free fluids inside the abdomen when they have underlying organ failure. Examples include a child with decompensated chronic liver can especially get complicated with ascites. Similarly, a child can accumulate fluids when they are having end-stage chronic kidney disease. In order to percuss for free fluids, you always have to move from area of resonance to dull. So you have to start your percussion from midline and then you have to go to either flank to demonstrate whether you can feel any dullness in the flank regions. පුතා මම ඔයාගේ බඩට ආයෙ තට්ටු ටිකක් දානවා හොඳද? If you note any area of dullness, it's important to turn the child and then see whether the dullness disappears. And sometimes when you have a lot of free fluids inside the abdomen, you will be able to elicit presence of horseshoe dullness or presence of a fluid thrill. It's also important to percuss for the bladder, as the bladder may be overdistended in the presence of a bladder neuropathy. The next step in abdominal examination is auscultation. You will have to auscultate for renal bruits and bowel sounds. The bowel sounds are best auscultated about 2 to 3 centimeters below and lateral to the umbilicus, whereas renal bruits are best auscultated about 2 to 3 centimeters above and lateral to the umbilicus. In a bigger child, the renal bruits can be best located by drawing a line between the xiphisternum and the umbilicus and then taking a midpoint and then going about 2 to 3 centimeters lateral from that midline point. It's also important to look at the child's back. Sometimes the scars may be hiding in the back and sometimes you will be able to elicit for any evidence of renal angle tenderness. පුතයි පොඩ්ඩක් නැගිටිමු. මේරි දෙනවද දැල්ලුවාම නේ? To conclude your abdominal system examination, it is also important to have a look at child's external genitalia to pick up any abnormalities as well as to perform a digital rectal examination. However, you have to be very gentle and respect the patient's privacy and then perform those maneuvers only if they are indicated. Putha, thank you very much. Well done. Right? අපි අද මැද ගමු.